Treatment. Treatment. External heat. Use herbs and formulas described in the external wind heat category, such as Lonicera and Forsythia combination, Yin Kiao San, and western herbs such as Boneset, Eupatorium perfoliatum, and red clover blossom, Trifolium pratensis. Internal heat and excess heat. One would use purgatives, Colagogis alternative, and heat clearing herbs such as gentian root, gentian scabrei, coptis, coptis sinensis, scotellaria, scotellaria bicalensis, dandelion, taraxacum officinalis, isatis, isatis tinctoria. Honeysuckle flowers, Lonicera japonica, and Forsythia flowers, Forsythia suspensa. If there is constipation, purgative herbs such as rhubarb root, Rheum palmatum, and the mineral mirabilitum sodium sulfate are employed. In Western herbalism, heat-clearing herbs are called alternatives and include red clover, Trifolium pratensis, Dandelium root, Taraxacum of Echinacea species, Golden seal root, Hydrastis canadensis, Gentian root, Gentian lutea, and burdock root, Artium lapa. Gypsum combination, Sigautang, Gentiana combination, Longdancy gantang, Forestia and rhubarb combination, Liang Jisan, used to clear heat from the upper and middle warmers while promoting bowel movement, and Coptis and Scoot combination, Huang Lian Ji Dutang. Deficient heat. Deficient heat characteristic of yin deficiency. The principle is to tonify yin and clear the deficient heat. Qi light. Often these people show a greater than average resistance to antibiotic therapy, which makes their infections particularly troublesome to treat. Not only in plenty of sleep and rest imperative, but they require more neutral to cool natured tonics, either alone or in judicious combination with heat-clearing herbs for effective treatment. In this case, you want to tonify the yin with appropriate yin tonics such as Chinese Ophiupogon root, Ophiupogon japonicus, Lycium berries, Lycium chinensis, unprepared Rehmannia glutinosa, Shengdi Wang, and asparagus root, Tian Mendong, milder chi tonics with yin nourishing properties can also be used, such as Polygonatum, Solomon's seal root. Next, in Western herbalism. In Western herbalism, nutritive demulcent or emollient herbs are employed, such as marshmallow root, Althea officinalis, Adalpha syrup in a base of blackstrap, molasses and honey, evening primrose oil, slippery elm bark, ulmus pulba, Iceland moss, Chondrus crispus, Ulnea, Usnea barbata, or comprae, root Symphytum officinalis. Ayurvedic herbs and formulas such as shilajit, a type of mineral-rich peach secreted from certain rocks in the Himalayan mountains. Kiavan Pras, a complex formula of over 40 herbs with at least 50% amla, Emblit myrobalance, and Shatabari asparagus racemosa are specifically used to clear deficient heat. Next slide. Difficulties in determining cold and heat syndromes. As with all conditions, it is not uncommon for there to be a combination of both pathologic cold and heat simultaneously. It is logically impossible for cold and heat to be in the same physical area of the body. In fact, a noticeable presence of either cold or heat likely indicates the presence of the opposite in another bodily area. With combined hot and cold syndromes, treat that which is most severe as the primary condition. This situation of mixed symptoms is commonly seen in clinical practice. In such cases, it is best to combine the appropriate formulas and herbs to treat the specific symptoms involved. Okay, next. Heat in the upper warmer and cold in the lower warmer. Symptoms may include conjunctivitis, sore throat, toothache, headaches, feverish feeling in the head and chest, sour and putrid vomitus, with cold spasmodic pains in the stomach, waist and legs with loose stool and clear urine. Depending on the nature and severity of the symptoms, either emphasize clearing heat in the upper warmer or tonifying yang deficiency and digestion in the lower warmer.